Hi everybody, my name is Ariana Little. I am aspiring to be a respiratory therapist. I'm first going to start off by telling you guys a few things about myself. I'm currently a manager at Advanced Radiology. I've been there for 2 years this coming August. I had actually became a manager after only being there for 10 months. I have 6 years of experience within the medical field. That's indirect patient care as well as direct patient care. On my free time, I enjoy roller skating, candle making, and I enjoy singing. However, I cannot sing to save my life. I believe that the job of a respiratory therapist entails one to be compassionate as well as empathetic, yet have skills of effective communication, attention to detail, as well as critical thinking skills. Our job as respiratory therapists is to help patients who are unable to breathe, whether that is to injury or illnesses. As respiratory therapists, our job is to maintain the primary care of all respiratory care, whether that's oxygen therapy, cardiopulmonary resuscitation, and many other therapies. I believe that I'm a great candidate for the respiratory therapy program because this is personal to me. I recently lost my dad last year to respiratory issues. He was diagnosed with sarcoidosis about 7 years ago, which ended up him having to get a double lung transplant. After that, things were going well after a while, but then after like 5 years or so, something like changed. With that, he ended up developing pulmonary hypertension, and his lungs were not able to release the carbon dioxide, which that caused him to be like lethargic all the time and things like that. After a while, he had to get on CPAP, but the CPAP was no longer helping. So he ended up going to the hospital and being placed on BiPAP because of how far along things were with the disease that he had, and that the therapies that they were trying were not working. They ended up having to put him on BiPAP. With the BiPAP, that wasn't life sustaining because of the stages that he was in. So him and I decided that it was best, to just stop all care, and we went from there. Honestly, without my dad passing, I have been so unsure about what I wanted to do, where I was going in life. But I have to thank him for me making this decision to go ahead and be a respiratory therapist, because he had so many respiratory issues. So it's only right that I go ahead and do it. On his deathbed, he had this absolutely amazing respiratory therapist who was compassionate, who was empathetic, who knew exactly what he was doing. He did everything like so right. Like, just by the way he walked into the room, he spoke, he explained everything that he was doing. He was very attentive, very honest. I asked so many questions. He just knew like how to answer, and he knew what to say. I know for a fact that I love people, and I know that I am very helpful to people, and people love my energy even when I'm just walking into a room. So I know that if that respiratory therapist can do it, I can do it as well. And lastly, in order for me to handle a situation with one of my classmates, I'm going to pull this person to the side and privately, so that where there's no other complications at hand, we are going to talk about it like adults. I'm going to check my tone of voice. I'm going to watch my body language and how I may say things. It is important that we communicate with each other. We can't coexist in any type of setting, whether it's clinicals, class, or work, if we can't be on the same page. It's important that we always remain professional, because at the end of the day, we all have a job to do. So I just want to thank you guys so much for the opportunity. I'm so excited about what's to come. I'm so grateful for this opportunity to even be able to give you guys an interview. I really hope to hear from you guys soon. Thank you so much. Have a good one, guys.